evening, and today we're going to look at exercise 2 on page 74, the reading exercise. Now we've quite a few exercises to do, so be patient and bear with me. So letter A says, with a partner, look at the list below. Which things do you think most doctors might not want to do themselves? Follow a low-carb diet. What's a low-carb diet? A diet which has restricted carbohydrate intake. Okay, so it's a diet where you eat hardly any carbohydrates. Who would want to do that? I don't know, but some people do it. I don't know. Go to the doctor with a long list of symptoms, have a full health check, have cosmetic surgery, see a counsellor, smoke or drink alcohol, sunbathe, take anti-malaria pills when visiting a country where it is endemic, take sleeping tablets, take vitamin supplements, use alternative medicine, and vaccinate their children against childhood illnesses like measles. Now, do you remember we said measles yesterday is a childhood illness, which causes the sufferers to come out in a rash? Do you remember? Sarampion, no? Now, what we're going to do is we're going to combine exercise A, exercise B, and if you're brave enough, are you brave enough? Exercise C. You can do it. Now, letter B says, read the article on page 75 once and complete the headings A to G with a treatment or habit from A. So pause the video now to match each paragraph with a treatment or a habit from exercise A, which basically is all of the things we have just read. Now, do you remember all of these things? Okay, so that's exercise B. Pause the video and do exercise B, because when you come back, we'll talk about exercise C. Okay, did you do exercise B? Okay, what about exercise C? Read the article again. Why wouldn't the doctors do these things? Match the reasons 1 to 7 with paragraphs A to G. So let's look at the reasons. 1, because it might be difficult later to stop doing this. Number 2, because the doctor may take you less seriously. 3, because the short-term benefit may be outweighed by the long-term problems. Number 4, because you may develop another illness as a result of unnecessary treatment. Number 5, because you may end up getting treatment you didn't really need. Number 6, because you may not necessarily be treated by a professional. Number 7, because you are doing something that is deliberately damaging. Now again, pause the video. Take a moment to do exercise C, because when we come back, we're going to read the article and we are actually going to correct B and C together. So take your time, pause the video, and do exercise C. Now, so welcome back. Welcome back. Let's now read the text now, and let's correct exercise B, the habit that is in each paragraph, and exercise C, the reason why doctors wouldn't do these things. Are you ready? Now, so on page 75, we have this wonderful, wonderful text, what doctors won't do. Doctors reveal the treatments or habits they would avoid. Now, I would never. So first of all, let's read the paragraph. I would never take up the regularly advertised offers by private medical companies. Why? Well, if you have symptoms, you go to your GP. Do you remember the GP? You're like family doctor, no? And they listen to your history, examine you, request investigations, and reach a decision. This process is known as diagnosis. A full check when you feel totally well is not diagnosis. It is screening. There are few screening tests where the advantages outweigh the disadvantages, and they could lead you to have potentially harmful investigations or indeed treatment that you may not have needed. One hears anecdotes about the advantages of health checks. One hears anecdotes about people who have fallen out of 6th-floor windows and lived, but I wouldn't try it myself. Now, this is Mike Smith, GP. How interesting, eh? Well, first of all, let's identify. Now, in exercise A, do you remember exercise A? Let's refresh our memory. exercise B, but we need to look at exercise A. Read the article once and complete the headings A to G with a treatment or habit from A. Which one do you think? Do you remember that exercise? Well, let's have a look. Are you ready? Here it comes. We've got have a full health check. So this doctor says, I would never have a full health check. Well, I suppose, what's the reason? Shall we look at the reason now? Do you remember? Letter C. What reason? Which of the reasons do you think is related to this text? Do you remember which reason? It's number 5. So I would never really have a full health check because you may end up getting treatments you didn't really need. So far so good? Any problems with letter A? If there are, just let me know. Let's look at letter B. I would never... Let's see what this doctor says. Patients often think this helps, but it makes the doctor's heart sink. They're not going to be able to deal with everything in one go, and most importantly of all, it makes them think you haven't got one particular problem. You've got a multiplicity of problems. That's a great word, multiplicity, which is a sure sign of a hypochondriac. So, which from letter A do you think is the correct answer here? What do you think? Well, I would never go to my doctor with a long list of symptoms. Now, let's find the reason. What's the reason? What's the reason? Why wouldn't this doctor go with a long list of symptoms? Well, it is in fact number 2. Because the doctor may take you less seriously. So I would never go to the doctor with a long list of symptoms because the doctor may take you less seriously. The doctor perhaps might even think you are a hypochondriac. No? Very good. Let's have a look now at paragraph C. So, let's see. People underestimate the risk. They think, my skin looks all right. How can it be damaged? Even if your skin doesn't look aged, you can end up with skin damage that sets you up for potential cancers in the future. Sunbathing in your teens and early 20s is a very strong risk factor. We are now seeing cancers in the under 40s that we used to see only on the faces of old, weather-beaten guys who had spent a lifetime outdoors. I would go out in the sun, but I would never lie in it with the purpose of getting a tan. I think this one is obvious. Do you remember? Whoopsie, sorry, excuse me. Which one? Which one do you think belongs here? Which one? I would never sunbathe, of course, and I think it's obvious talking about skin damage. No, just want to point out some nice vocabulary here. Can you see weather beaten? Weather beaten means basically that your skin, especially the skin on your face, has been affected by the inclement weather condition. So maybe if you work outdoors, you've spent a lifetime outdoors. Maybe farmers would be a good example. Well, they usually have what we describe as weather-beaten skin. You can see the effects of the weather on somebody's skin. Now, this person says, I would never sunbathe. What is the reason for that? Well, let's go back to letter C on the previous page, page 74, and let's find out why this person would never sunbathe. And again, I think it's a little bit obvious, number 7, because you are doing something that is deliberately damaging. So this person says, I would never sunbathe because you are doing something that is deliberately damaging. How are we doing? So far, so good? Well, let's have a look now at paragraph D. Now, I have come across many patients who have been taking them for decades. They are addictive, and it can be very difficult for people to wean themselves off them. Now, do you remember we saw that verb before, to wean? Do you remember? To wean means to reduce gradually, little by little. We saw it when we were talking about addictions. Do you remember? Good, good. Now, you don't have to say because I'm not going to know, but, I'm going to ask you anyway. No? Wean. No? So, the side effects can include falls, confusion, sleepiness in the daytime, and the feeling that increasingly high doses are needed to achieve the same effects. I can't imagine any situation in which I would start using them. Now, again, I think this one could be obvious. So, I would never take sleeping tablets. No, this doctor says I would never take sleeping tablets. Now let's see the reason. Did you find the reason? What letter is the reason? Let's see, exercise C. I would never take sleeping tablets. Number 1, because it might be difficult later to stop doing this. No? So I would never take sleeping tablets, this doctor says, because it might be difficult later to stop doing this. How are we doing? So far so good? We're nearly done. Let's have a look at letter E now. Why? Because although you will probably lose weight, it may kill you. Ooh, I don't like the sound of that. Don't take my word for it. Read about the 43,396 Swedish women followed for an average of 15 years. Those who stuck to low carbs and high protein had a rising risk of dying from heart attacks and strokes. There was a staggering 62% higher risk of such illnesses among the women eating the strictest diet over those who ate normally. Eating is for enjoyment. These diets turn food into medicine, and it's the wrong medicine. Now, here we have the very nice word staggering, and staggering is like kind of very shocking, no? A staggering difference, no? So a shocking risk, no? Now, what are we going to put here? Now, again, I think this one is fairly obvious. I would never follow a low-carb diet. So this doctor says, I would never follow a low-carb diet. Now, let's see the reason. Were you able to find the reason? Were you able to find the because? I would never follow a low-carb diet. Any ideas? I think number 3. No? Because the short-term benefit may be outweighed by long-term problems. Now you have an increased risk of heart attack, of stroke, no? So I would never follow a low-carb diet, no? Because the short-term benefit may be outweighed by long-term problems. Are you ready for letter F? Here we go. Now, the reason for my reluctance, nothing to do with anesthetics, safe these days, but entirely to do with surgery, which should never be undertaken for what you might call soft reasons. It's not that surgery is so dangerous that I would worry about death. Mainly, it's the worry of an infection, which can be very unpleasant. Now, of course, he's not going to say anything about the anesthetic because his name is Mark Patrick and he is a consultant anaesthetist. Oh my God, anaesthetist. I'll try it again. Anaesthetist. That's a hard word, eh? Anaesthetist. Got it the third time, eh? Third time lucky. Now, what is it that he says he would never do? Well, again, I think it might be easy, this one. He would never have cosmetic surgery. So this doctor says, I would never have cosmetic surgery because, what's the reason? Let's find that reason. Because. Any ideas? Number 4 or number 6? What do you think? Well, I think we're going to go here for number 4, very good, because you may develop another illness as a result or of unnecessary treatment. Now he talks about the risk of infection, I think primarily, no? So this guy says, I would never have cosmetic surgery because you may develop another illness as a result of unnecessary treatment. Very good. Excellent. What about the last one? Letter G. Let's see. I would never see a counsellor if I was having mental health problems. Absolutely anyone can claim to be a counsellor. It's an entirely unregulated area. As a result, there's a huge variation in quality, and I have seen too many patients who have been further psychologically damaged by seeing poorly qualified counsellors. Now, this is interesting because this was Max Pemberton, and he's a psychiatrist. Now, there's only one left. There's only one left. So this person says, I would never see a counsellor. Now, remember earlier when I told you a counsellor can be a therapist or a psychologist, but it is true. They're not usually officially kind of recognized psychiatrists, no? So they are people who may have, let's say, as they say here, he says, they are poorly qualified counsellors because maybe they don't have the necessary medical qualifications. No, maybe they've done some different types of course. No, now what's the reason? Well, I think we've just answered that question. So he says, I would never see a therapist because you may, letter number 6, not necessarily be treated by a professional. Now, I hope that wasn't too confusing that we did all of those exercises at the same time. My apologies if it was. Now, let's have a look at exercise D, which is Lexis in context. And I'm a big fan of Lexis, and I'm an even bigger fan of context. So let's see. Look at the highlighted phrases. With a partner, work out what they mean and try to paraphrase them. So let's have a look. Now, of course, we can't work with a partner. I'll be everybody's partner. And by that, I mean I'll do the hard work. Let's see. So in the first paragraph, we have the advantages outweigh the disadvantages. In the second paragraph, we have it makes the doctor's heart sink. In the third paragraph, we have people underestimate the risk. In paragraph E, we have don't take my word for it. In paragraph F, nothing to do with. So can you see these highlighted expressions? Oh, and of course, excuse me, I forgot to mention at the bottom there, we have a glossary. No, but I think the meaning is clear from the text. Now, screening is the testing or examining of people to see if they have a disease when they have no symptoms. But I think it was very nicely explained in the first paragraph. Now let's go back to talking about our highlighted expressions. Have you got some ideas? Well, these are the ideas which are suggested by the book. So if you use the expression, the advantages outweigh the disadvantages, that means that there are more advantages than disadvantages. It makes the doctor's heart sink. Well, it makes the doctor feel depressed. Well, if your heart sinks, you feel upset, you feel depressed. People underestimate the risk. People don't realize how dangerous it is. So if you underestimate something, it means you don't give it perhaps the full understanding of what is, in this case, at risk. Don't take my word for it means don't believe me. And nothing to do with means there is no connection with. So there's some very nice expressions from this text. And again, it's a text, now if you have noticed, which is adapted from, I didn't mean to say adapted. It's from The Guardian. Can you see? Now, I'm a big fan because I think the English in The Guardian, I think is very nice, no? So let's have a look. There's just one more thing to talk about, which is letter E. It says work in small groups. Do any of the doctor's opinions surprise you? Might their opinions affect the way you behave? Why or why not? Is there anything connected with medicine or health that you would never do? Now, you know what I'm going to be asking you in your Zoom classes. So have a think about that. That's all for today. Thanks for listening.